Good morning. This is Dr. Saswati Mukhopadhyay, and I'm a consultant clinical geneticist from Apollo Multispeciality Hospital, Kolkata. Today I would like to share a few facts about Turner syndrome. Turner syndrome is a chromosomal disorder and it is present only in females. The girl will be short-statured and there will be some physical features which are specific to Turner syndrome, like there can be ptosis, that is drooping of the eyelids. There can be increase in the carrying angle of the elbow, that is when the girl is facing you full face front and her arms are extended, then the elbows appear to be angulated rather than straight. Also, there is webbing of the neck, which is a very characteristic feature of Turner syndrome, where the neck is not straight, rather there is extra skin fold on either side of the neck. This is called webbed neck. Apart from that, there is also increase in the space between the nipples, and that is called shield chest, and there is hardly any breast development at puberty. Usually during puberty, when girls increase in height, then there is increase in the breast development and also appearance of menstruation. Nothing like these can occur in a Turner's girl child. This is because genetically she has only one X chromosome rather than two, and all the features of Turner syndrome are because of the lack of one X chromosome. This results also in streak ovaries, that is, the ovaries which are present in this girl will be having no follicles, and so no maturation of the follicles or egg development at every menstrual cycle. Consequently, there is no menstruation. Also, the uterus is very small, very much immature, and there is no development in the size of the uterus. Usually they have little difficulty in learning, particularly they are not very good at mathematics because of some spatial skill absence. However, apart from this, usually the intelligence is normal and there is no developmental milestones are achieved excepting for menstruation and the pubertal developmental milestones. So this is genetically this is caused by the lack of X chromosome, and it is usually a sporadic feature, meaning it is not recurrent in every girl child of the mother. Possibly there is some difficulty, there is some segregation difficulty in the mother, resulting in one cell having both X chromosomes and one cell having no chromosomes. So if the father has fertilized using one X chromosome of the sperm, then the child will be born with a single X chromosome contributed by the father and no X chromosome contributed by the mother. This is called XO, and these children, as I said before, will have almost no chance of pregnancy unless and until they use egg donation. Apart from these physical features, there is another quite a serious consequence of Turner syndrome children, that is, they have some congenital heart malformations, usually called coarctation of aorta. That means the main blood vessel, that is the aorta, which is supplying blood from the heart to different organs of the body, that is narrow at the point where it leaves the heart chamber. And because of that, there is some difficulty in getting pulse in all 4 limbs of the child. That is, sometimes the pulsation is absent in one arm and present in the other, or there might be a feeble pulse, and the blood pressure measured in either arm can differ by at least 10 millimeters. So all these physical features that I have mentioned are specific to Turner syndrome. Now, if you are wanting to know at the time of pregnancy whether your child is going to have Turner syndrome or not, it is very simple. That is, prenatally we can do a genetic test at 13 weeks or also 18 weeks, and we can find out the chromosome nature of the fetus and consequently the baby at the time before delivery by a simple test which is called QF-PCR, or also by microarray. Now, this Turner syndrome, still it is some stigma is there for Turner syndrome, but apart from the reproductive health and a little bit of learning disability, the Turner's child should be nurtured, they should be allowed to pursue their career options to the best of their learning abilities, and as I said, IVF offers a lot of possibility in the childbearing capacity of this Turner's child. Thank you. I hope it was informative, my talk, and if you have any further questions, you are always free to discuss with me. I am available in Apollo Multispeciality Hospital in our genomics clinic. Thank you once again.